progression starting from the infection to AHI stage, which is an important stage to health providers because it clarifies the transmission. Let's go to the acute HIV infection, which some people has reaction or some not, and the chronic HIV infection, which is very highly contagious, and finally the acquired immunodeficiency syndrome, the AIDS. The World Health Organization in 2019 described HIV as a global epidemic with 38 million people living with it. Now, the causative agent member is a retroviridae family. The lentivirus is roughly spherical with a diameter of about 120 nanometers. Is an enveloped icosahedral virus with single-stranded RNA. We have two pathology strains, HIV-1 and HIV-2. And the virulence is defined as the rate to AIDS.
What we have here is a bowl of sugar water representing life itself, the body, the human body. And we're going to add some yeast. Yeast representing the AIDS or HIV infection going into the body. We'll revisit this in just a moment.
Now we will talk about the transmission. The HIV is originated through chimpanzees. The animal virus version name is simian immunodeficiency virus, SIV, transmitted to humans by eating the meat of primates with the SIV infected blood. That make the disease became a zoonist. Now, after that, today, the transmission only happen among human, and is a bodily fluid transmission, and it happens in several ways. The most common is the vaginal or anal sex, or sharing needles, syringes for injection of drugs, or as you use the tattoo equipment without sterilization, during pregnancy or the labor when it's delivering the baby, or while the mother is breastfeeding. Also, that happen through a blood transfusion, organ or tissue transplant. The pathology, the manifestation, the acute HIV infection symptoms present after the AHI period, which is known as an eclipse phase, usually after 10 days. And we're gonna have the acute HIV infection, which some people has symptoms and some people has none. After that, if not treated, we have the chronic HIV infection, and this can deliver the patient to the acute immunodeficiency syndrome, AIDS. And in the AIDS, the patient can acquire any kind of disease because the immunodeficiency is low. Finally, the pathology. The pathology of HIV are a battle of HIV replication versus the immune responses in the white blood cells by way of both cell and immune mediated reactions. The HIV virus impacts the CD4 plus T cells, destroying both directly and indirectly. Treatment and prevention. The medications therapy helps to keep HIV from progressing to AIDS. We have 6 options here in treatment, but the best prevention method include being tested for HIV and the other sexually transmitted infections, STIs, use condom, avoid sharing needles or other paraphernalia. And here we're gonna keep in mind what is the best treatment for HIV.